Video time?
Video time.
Already wrote it up on the board. Come on over. You're not too shaky, right? You had a cup of coffee.
I'm good, I'm good.
Okay. Great question. Do you need an x-ray? I get this all the time, and the majority of the time, 99% of the time, is no, you don't need an x-ray for your injury. But it doesn't stop the doctors and the orthopedic doctors from ordering it. And what they end up doing is making a lot of assumptions or false claims based solely just off the x-ray. So what does an x-ray look at? It looks at the bone. It looks at the joint space itself. That's what it does. But the majority of people's injuries are actually a tissue problem. So I don't know of any magic x-ray machines that can actually show a tissue problem. So when should you get an x-ray? If you've had a recent injury where you fell and you feel like a bone's broken and it's like popping out of your leg, yeah, I would start with an x-ray on that one. I've ordered 2 x-rays in the last 2 years in my practice. One was an obvious stress fracture on the patient's foot, and the other one was I was just trying to get an idea of how much joint space they had in there, so if I could get the MRI approved by the insurance company, and that's a whole different rant on that. So what happens all the time? I've done this a million times. Not a million, but I'm exaggerating. I've done this a lot where I've had a patient and I sent them into the orthopedic doctor with an MRI that they've already had. What the orthopedic doctor does is actually takes x-rays again in the office when they come in. So they do this because they want to bill your insurance again, which is messed up. I talk about that all the time. But that by itself is bad enough. But here's the problem that ends up happening is they start to make a lot of false claims on the x-ray itself. They tell people they have a torn rotator cuff, they have disc injuries, they have all these kind of things. You can't make a clear case for anything off an x-ray. It doesn't show you any of those tissues. So many people come in and go, you know what, I was good. They took an x-ray of my knee or my hip or my shoulder or my neck and they said everything's good and I'm good to go, but yet you're still having pain and you're still having the injury. The x-ray didn't tell you anything. So always question your doctor before, especially if they jump right to an x-ray and they start telling you things about soft tissue, ligaments, joints, and everything like that. They're actually doing you a lot of harm and not giving you an accurate diagnosis for what's going on. So we always want people to just be better informed and understand what's really going out there in the musculoskeletal world and make better decisions so you don't have to continue dealing with your pain and injury. So if you've been diagnosed with a problem solely off x-ray, that's not going to be the full case. You need to get a full MRI and get an idea of what's going on. We'll see you guys a little later for our last video of the day. Have a good one.